Hello, everyone. My final project for the health and culture class will be based on the film The Good Nurse. And what I will mostly be talking about is just health insurance and the trust between your medical provider for the information that's going to be presented in these next few slides. So before I get into the two main topics that I want to talk about for this presentation, I just want to give a little film summary about the main characters, that being Amy and Charlie. So Amy is a single mother of two daughters who works the night shift at the hospital so she can support her daughters and be able to pay for her household bills. She works in the ICU department at the hospital for the overnight shift. She does have struggles of her own apart from her being a single mother. She has to deal with a serious medical heart condition, that being cardiomyopathy. So before I get into the rest of the film summary, I just wanted to give a quick little information of what cardiomyopathy is. And this is going to be a direct quote from the Mayo Clinic website. And I will have all the references towards the end of the slide if you do want to take a look at that. But the definition for cardiomyopathy that the Mayo Clinic has on their website is that cardiomyopathy is a disease of the heart muscle. It causes the heart to have a harder time pumping blood to the rest of your body, which can lead to symptoms of heart failure. So here are just some symptoms that are also listed in the Mayo Clinic website. So these are the symptoms that you will have if you do have cardiomyopathy, which we do see in the film itself when she has a shortness of breath. So we have shortness of breath or trouble breathing with activity or even at rest. So she does have to move a lot during the film with moving patients, taking care of them, cleaning them. So that does involve a lot of activity. So she does become short of breath. We have chest pains, especially after physical activity or heavy meals. Heartbeats that feel rapid, pounding, or fluttery. Swelling of the legs, ankles, feet, stomach area, and neck veins. Bloating of the stomach area due to fluid buildup. Cough while laying down. Trouble lying flat to sleep. Fatigue even after getting rest. So we also see this in the film with her having fatigue. Dizziness and fainting. And at one point in the film, she does collapse and faint, and she needs to be treated in the hospital. But yes, do keep this in mind with the symptoms. But just keep in mind that not everyone will have all of these or even the same symptoms. But going back to the film, Amy starts having symptoms of chest pain and shortness of breath. When she decided to see her healthcare provider, she was told that she does have to take it easy for her health so it doesn't get any worse. And she also has to pay $950 for that medical consultation that she had. She doesn't have any insurance at all since she just started working at this hospital, so she does have to wait a couple months before she becomes insured. Because she has two daughters and she needs to support her family income, she basically works herself and doesn't care. Well, she does care, but at that moment, she does not care about her health deteriorating because she has two daughters that she needs to take care of. So a key takeaway that we want to get from here is the lack of insurance. I will go into more detail about insurance and how that affects the population in the future slides, but keep this in mind that she does not have insurance. The other main character that we have is Charlie Cullen. He is a new hire nurse working in the same department as Amy. He was hired to help out the department since it was short staffed, and Charlie seemed to be a nice guy and helped out Amy when he finds out that she has heart problems. He is there to support her in her time of need when she can't do any heavy work or just can't stay there helping a patient for a long period of time. But when he starts getting close to Amy, Amy starts noticing that he is acting a bit suspicious because there seems to be a lot of codes happening in the hospital once he was hired. A lot of patients seem to be progressing well in the ICU, and then all of a sudden they just ended up passing away. So it did become very suspicious. There was an internal investigation going on in the hospital, and when those internal investigations were happening, that's when Amy was growing more and more suspicious of him. When she started going around and seeing if there was anything going on in the hospital, Amy did find out that he was putting insulin in patients' IV bags that was causing the patients to start coding from the overdose of insulin. So Amy was able to get evidence when she started working with the detectives who were trying to crack down on Cullen for all the mysterious deaths and codes that were happening in his presence. And none of the hospitals that he worked at seemed to be wanting to cooperate. And I believe it was over 9 hospitals that was said in the film that he worked at, but none of them wanted to say anything. Why? It was mostly probably because publications and because they would start losing money, is what I would presume what was happening here. But Amy was able to get evidence to the detectives, and he did end up getting convicted. And it is said that he killed over 400 patients in between the hospitals that he was working at. But how does this film speak on the healthcare system? Well, there are two main points that I wanted to discuss, and again, we'll go into the insurance aspect of it, of people not being insured and how that affects people's health. And then we also want to go over the trust that we have with our medical providers. Since we are in a vulnerable position when you are hospitalized or in a clinic, you are in a vulnerable position and you expect to be taken care of with these medical providers, but when these things happen, it's like you lose trust in the healthcare system. So I do want to talk about that a little bit and why it could be that people wait so long to get treated. Here in this slide, I have a graph that shows the percentage of people under the age of 65 who are uninsured at the time of interview by duration without coverage and age group in the United States. So this one is mostly just information between the age group, but the article where I got this information from was from the National Health Statistics Report. So I will be quoting a few lines here from the article itself of how this information was obtained. So here for the quote, it says, estimates are presented by selected socio-demographic characteristics including age, sex, race, and Hispanic origin, family income, education level, employment status, and marital status. So another quote that I have from this article would be the results. So it says, in 2020, 31.6 million, that being 9.7%, people of all ages were uninsured at the time of the interview. This includes 31.2 million, it's about 11.5%, people under the age 65. Among children, 3.7 million, 5%, were uninsured, and among working age adults ages 18 through 64, 27.5 million, that being 13.9%, were uninsured. Among people under age 65, 64.3% were covered by private health insurance, including 56.6% with employment-based coverage and 6.7% with directly purchased coverage. So based on the statistics from this report that was published in 2022, a lot of people, millions of people, are uninsured, and really this can lead to having a lot of either undiagnosed health problems or people avoiding going to the doctor because of being uninsured and being unable to afford any of the medical visits, prescriptions, etc. when it comes to healthcare. So that is a major problem when it comes to uninsurance. It's just that it's not affordable for a lot of people. The other point that I want to talk about was the fear of being seen by a medical provider and how that affects trust. Another quote that I do want to bring up, and this would be from Fear of Being Seen from the Nasiha mental health website. So here, for the fear of being seen, quote says, at its core, the fear of being seen revolves around vulnerability. It is the anxiety one experiences at the prospect of being exposed, whether the exposure involves one's true emotions, opinions, or physical appearance. This fear, rooted in both social and psychological mechanisms, manifests in different ways. It could be an aversion to public speaking, a reluctance to share personal stories, or even an unwillingness to embrace one's achievements. So, keyword that I would take from that quote is where it says revolves around vulnerability. So with that, again, you're being very vulnerable when you're going to a medical facility. So with this film, since it is based on a true story, just imagine you seeing a nurse, someone who's supposed to be there for you, be there to advocate for you, to take care of you, and all of a sudden you just see them on the news saying that they killed multiple patients under their care. That's just something that would also give you basically the information, and I mean, it's on the news, you're seeing it right there in front of you, of not trusting that medical facility, that being the hospital or just the medical providers in general. So that does really affect people's perspective on trusting the medical provider. And the film does do a good story in telling that, but I feel like during the whole film, it's just that it sounded like the hospitals themselves didn't want to expose or say that yes, a lot of patients died under his care, because I do feel like if that information was out there earlier, it would have made trust to the medical providers very low. So that also includes the medical providers getting less money because there's no trust in you going there, so they're not going to make any money. So I feel like this is something that needs to be advocated a little bit more. It wasn't really talked too much in the film. And to be honest, I don't really see that as much either when it comes to researching documents for this. There isn't really a lot of articles you can find out there where a hospital is taking accountability for their staff's actions. The good thing is, he was convicted. He is serving multiple life sentences in jail, so that is a good thing. But the main point of this presentation is mainly being uninsured, how that can take a very affecting toll on your health itself. And I mean, it's not necessarily affordable for a lot of people to be able to afford healthcare. And if you have many bills and you have family that you need to take care of, priority is going to be working and not your health. So it is something I feel like it needs to be worked on as a whole for the United States in making healthcare a little bit more affordable. That being making the cost of medication, of visits maybe less, or just having more affordable insurances available out there. That's really something that needs to be improved around any population, really. I wouldn't say it matters too much on what race or ethnicity one's from, but it's mostly just the cost itself. A lot of people aren't in that. Uh, they're not making a lot of money, so it's a problem in the United States as a whole. But yep, that's pretty much what I have for this presentation. In this next slide, I will just be showing all my references that I used for this presentation. But thank you so much for listening.